All right, so good morning. My name is Brooke Frazier. I'm the infection prevention manager here. So these are some infection prevention tips, some basic stuff, and then some information about preventing claudies and CLABSIs and surgical site infections. So number one best way to prevent infections, anyone? Hand washing, right? So very easy to do. Florence Nightingale knew to do it 150 years ago. We still know to do it. Very easy, but also very easy to forget, okay? So please make sure anytime you're coming into the room, going out of the room, before you touch the patient, after you do something gross, before you put gloves on, after you take gloves off, all of those times you need to clean your hands, right? The gloves, a lot of times people think, well, I'm completely protected if I have the gloves on, but there can be microabrasions in those gloves, and so you want to make sure that you're cleaning your hands after you use them, okay? Any questions with hand washing? So because I'm infection prevention, I have to bring you a gross you out slide. So this is a room. This is the patient's room. Sometimes we think, well, just because I'm not going to touch the patient means I'm not going to get my hands dirty if I come into these rooms. This shows you kind of all the areas that can become infected with patient's pathogens pretty quickly in a room. All this to say, make sure you're cleaning your hands anytime you're coming in and out. And also make sure you're limiting what supplies you're bringing into the room. You know, it's tempting to go grab like everything you might need for 14 days and stick it on this counter. Well, anything that you don't use, we're gonna have to throw away because it's potentially infected. And same with reusable equipment, right? So this is just a little reminder that these rooms, it's everywhere. And so anytime you think you're gonna just slip in, make sure you're cleaning your hands coming in and out. Questions on hand hygiene? I know you guys know to do it, it's just a reminder, making sure. All right, we have 3 kinds of contact isolation in this hospital. I think it's a little bit confusing for people, so I wanted to go through it with you. Contact isolation is for regular pathogens that are transmitted through contact. That you can see the sign up here, it's a red sign. It got a little tie-dye on the side, but it's a red sign. For those patients, you always want to wear a gown and gloves when you come into the room, every single time. You want to use the purple top wipes. So those are these guys right here. Does anybody know the dwell time? How long they have to be wet for when you use those?
2 minutes.
2 minutes. Awesome. It says it on the bottle. Joint Commission loves to ask people this question. So if you panic when they ask you, it's on the bottle. And it means it has to be wet for 2 minutes. So not like wet it and set it down for 2 minutes, but keep it wet. And because I'm the kind of person I am, I timed it and it's about a minute and a half before it dries out. So you do have to keep it wet, okay? And then you can use the hand gel coming in and out of these rooms. So the second type of contact isolation we have is modified contact. This was developed by HCA and St. David's to try and make it easier on caregivers because we have a lot of isolation. So for these patients, if you're gonna touch the patient or the bed, you need to wear gown and gloves. If you're just coming in to put your name on the board, to hit that pump that won't keep beeping or get something from the bathroom, you just need gloves, okay? So it's trying to make it a little bit easier on you. For those patients, you still need the purple top wipes are good, and then the hand gel is fine as well. So the third type is your contact plus isolation. So that's for patients who have C. diff, and these patients, you want to wear a gown and gloves every time you're coming into the room. You also want to make sure that you're using the bleach top wipes. So the purple wipes will not kill the C. diff spores. C. diff can form these spores that can last for years on surfaces. It's a little terrifying. So you need to use the bleach top wipes. Anybody know the dwell time on those? 4 minutes. Awesome. And again, you have to keep it wet for 4 minutes. So that thing is your baby. So it's like, every time you bring a glucometer in these rooms, you're gonna have to keep that glucometer with you for 4 minutes to keep it wet. The other thing you need to do is make sure you are using soap and water, washing your hands when you're leaving the room. You can use hand gel coming into the room, but you need to use soap and water going out of the room. I like to use the sink in the room because I know, as soon as I step out of that door, I'm gonna get grabbed by somebody else. If you do that, crack the door before you start, you can wash your hands and then go straight out of the room. You wanna try and keep your sink area really clean in these rooms because when you're washing, those spores can go, splash out and get onto whatever supplies are around it. If you can't wash your hands in the room, if it's a dialysis patient or whatever's going on, try and head straight for the sink to wash your hands with soap and water, okay? Any questions about those 3 kinds of isolation? Okay, Next, we'll move on to CAUTIs, or catheter-associated urinary tract infections. This is the most common HAI, or hospital-acquired infection. About 40% of hospital-acquired infections are from catheters. The best way to prevent it is to get that catheter out as fast as we can, okay? About every day, there's about a 5% increase in risk for infection that we leave that Foley in place. The hospital does a really good job. We review every morning. Your managers come to safety huddle and we talk about every single line on every single unit and whether we still need that line. The other ways that pathogens can be introduced with these catheters, the first is this during insertion. So you always want to make sure that you have a second nurse with you watching when you're inserting a Foley to make sure that you're not breaking sterile technique, okay? Making sure that you're keeping things really clean when you're inserting that catheter. The second way is it can come in through the bag. So if you look at this tubing, there's no valve. There's no one-way valve to prevent backflow. So it's just whenever it's going this way, it's gonna go whatever way gravity goes. So you wanna try and make sure you keep this bag as empty as possible before you ambulate a patient. So I usually, if you're gonna ambulate them, I would empty your bag because that's gonna reduce your risk. You need to keep the bag below the bladder. So you wanna make sure that you're not hooking it onto a patient's gait belt, for example, or the IV pole. Most patients are not tall enough for that to be a good place to hang it. You wanna make sure, if you have the walker, you can use that bottom rung of the walker to hold it. And then you wanna make sure you're avoiding a dependent loop. So we all know that if the Foley is like this, we've got a dependent loop, right? But this can also be a dependent loop because we're preventing the flow. Anytime you see your catheter is not actively flowing, then it's slowing that urine down, and the urine, it'll start forming a biofilm. And the biofilm is like this amazing protection for bacteria, and it makes it really hard to remove, and it makes it really resistant. It's 30% more resistant to antibiotics if it has that biofilm. So obviously that increases the patient's risk. So my tip for avoiding dependent loops in the bed, you know, we all know you fix it, it looks perfect, the patient moves his leg and it's straight out of the bed, right? So I like to clip it right at the end of the bed so it's not fighting gravity, and then run it between the mattress and the end of the bed so that there's really nowhere for it to go, okay? And it'll keep a nice flow, and it usually will stay in place this way as long as your green clip is holding it there. And I've got some pictures in there of that. And then if you look on the chair is kind of the hardest place to try and prevent a dependent loop. You guys will probably have to come over here. So what I see a lot when I come in these rooms, you know, I come and audit every day, I'm auditing in rooms. I see a loop like this. So I'll see it comes from the patient, and you can see that it's really hard for that urine to start flowing. So if you have a patient that's not as big as the chair, then you can do what we call a horizontal loop. So you can run this catheter, because this tubing's so long, right? You're like, what do I do with all this tubing? You can run a horizontal loop. This is getting really wiggly since I've been playing with it all morning, but you can run it next to the patient, okay? So a loop like this is all right, and it's gonna keep it flowing, all right? The other thing, if the patient is as big as the chair and there's nowhere to go, there's no real estate in the chair, you can hook it to the end of the bed. Obviously the bed should be lower than this one is right now anyway. And then you can use the green clip to clip it to the side of the bed and then keep your flow, okay? So that you have a nice flow all the way through. Questions about CAUTI's prevention? Okay, we're moving on. So Melinda was nice enough, we got some beautiful photos of how to use that stuff. This guy right here is just a little summary of all of our bundle elements to prevent CAUTI's. So the next thing is CLABSI prevention. So central line associated bloodstream infections. A lot of the same techniques work with CLABSI. So number one is to make sure that if we don't need that line, we're getting it out, right? We're reducing that risk in the first place. Making sure we're doing a CHG bath daily. You know, if the patient has a PICC line in their arm right here, the CHG bath doesn't just involve this arm, right? You use all 6 of those wipes. It covers the whole body from here down, right? It needs to build up that tackiness across the skin to make sure it's protecting. On the lines, you want to make sure you have orange caps on all your ports. Make sure your dressing is dated and timed so that people know that it's still good when they walk in. Make sure you're using good hand hygiene and gloves when you're touching the line or the dressing, and teaching your patients the same thing. You know, patients will start playing with their tubing. Excuse me. And you want to make sure that they're keeping it clean. And then make sure you're not drawing blood from that line unless you have a special order to be doing that. If you look at this picture, it'll show you, you want to make sure that your insertion hub is right in the center of the CHG dressing. The dressing is dated and timed, and the hub of the introducer is under that dressing as well, so that it's getting the maximum benefit from that CHG. If you look at the next slide, this is a poorly applied dressing. You can see that the tip is like right at the end of that CHG, so it's not really getting that protection. And then, you know, the sides are peeling up. They're using this H-taping dressing on the end over the tubing rather than the end of the dressing. Sorry. Okay, and then if you look at the next slide, the one on the right, I think we would all know that that needs to be changed if it's so bloody. The one on the left shows a saturated dressing. So if you start to see color, a little color change on these, if it's yellowish, if you push your thumb into the dressing and you see a concave impression that stays, that's a sign that the dressing is saturated and needs to be changed. And the last one is a picture just to show you that if it's oozing, if there's a little bit of blood oozing within the CHG, it's totally fine. You don't have to change it. If it's outside of that CHG square, then it can get into the dressing become porous, and it can wick in bacteria. So that's when you need to change the dressing. All right, questions about Class E? Surgical site infections. So we want to prevent any surgical site infections on any patients that would have surgery in the hospital. There's a number of things you can do as an inpatient nurse. So before the surgery, you're making sure they get a CHG bath, making sure they're screened for MRSA if they need to be, and they get the mupirocin if they need, making sure they get the antibiotics beforehand and a good skin prep. And then after their surgery, you want to make sure they have good glucose control. The blood sugar is well controlled so they can heal well, good normothermia, and then good hand hygiene and clean dressing changes. We have had a number of colorectal surgical infections in the hospital, and so we developed this best practices bundle. It's a checklist. It's on a golden yellow sheet. It's located on 4 South, right? So you can pick it up. So if you have a patient, you want to make sure you grab one of those checklists. You put the sticker up at the top. You put the surgeon's name and things here, and then you make sure that they get a CHG bath the night before their surgery. And then in the morning, CHG bath the night before and a mechanical bowel prep the night before. Then you want to make sure that they're clear on that mechanical bowel prep. If not, you want to call the surgeon so they can add an enema. And then the morning of surgery, you want to make sure the patient gets clipped. So they clip the hair. If you look, this back page has a clipping guide, so it shows you exactly where to clip. It's from bed sheet to bed sheet all the way across their abdomen. And these patients, you know, a lot of times now they're not getting clipped. They don't have time to clip them in pre-op, or they don't have a bed space, and so they go straight into the OR and they get clipped. When they clip in the OR, it can go up to 6 feet from the surgical site and actually cover the sterile field, so the instruments can have, you know, pubic hair on them, and which we obviously want to avoid. And then you want to make sure you do a blood sugar check on diabetic patients before they go down, so there's a baseline of what their sugar is like. And then any antibiotics they're getting in patients. And Melinda made this beautiful guide that's on the back that's available if anybody needs or has questions. The CNCs, the managers know about it, so they can help. All right, thank you.